Hello everybody, welcome back. We are going to start on Chapter 12, which are the anti-neoplastic chemotherapy agents. Okay, first we're going to start with a little introduction. So cancer, otherwise known as carcinoma or abbreviated as CA, is a group of diseases that are characterized by an uncontrolled growth of cells. Currently, there are more than 100 types of cancer identified in the U.S. It is right now the second leading cause of death in the U.S., heart disease being the first. And it can be caused by internal and external factors. Internal factors might include inherited gene mutations, hormones, or strength of a person's immune system, whereas our external factors are going to be things such as the use of tobacco, infectious organisms, and exposure to chemicals and radiation. That does include sun exposure. So normal body cells divide and multiply, replacing old ones. When the rate of that cell division is disrupted and it's not controlled, an abnormal growth of cells is going to form, and that is referred to as a neoplasm or a tumor. Okay, neoplasms may be benign. They resemble normal tissue, they grow slowly, they're highly organized cells, and they usually don't spread to other tissue. Or they can be malignant, which is cancerous. These cells are highly unorganized, they're immature, they multiply rapidly, and they do tend to invade other tissues. Now, the original site of a tumor is called the primary site. Once they spread from another tumor, or they spread to form another tumor, it's referred to as metastasis. And each new location is called a secondary site. Now, there are, excuse me, 7 warning signs of cancer. They do spell out caution, so that is an easy way to remember them. That's a change in bowel or bladder habits, a sore throat that does not heal, unusual bleeding or discharge, thickening or lump in breast or elsewhere, indigestion or dysphagia, obvious change in a wart or a mole, and a nagging cough or hoarseness. And one other thing that I want to mention is the ABCs of skin cancer and melanoma. A obviously is for asymmetry. If one half does not match the other half, we're looking at obviously moles here. The border, if it has uneven borders. Color, there's a variety of colors, brown, tan, or black. Diameter, if it grows larger than the size of a pencil eraser, which is about 1/4 of an inch. And evolution, that's a change in size, shape, color, elevation, or another trait or new symptom. So there's just a few things to keep in mind when we're talking about cancers. Okay, so moving on to our chemotherapy agents. Anti-neoplastic agents fight cancer. They can be used as systemic treatment in the primary or main tumor and its metastases. Okay, the agents are cytotoxic, meaning that they harm the tumor cells as well as healthy ones. They're given IV in very high doses and on an established schedule. They're used for remission, which is the abatement or stopping of symptoms and a possible cure. Or palliation, which we talked about before. That's where it puts putting a band-aid on the symptoms, but it's not curing the disease. It's classified according to their mechanism of action, which we will go through here in a moment. Chemo side effects include nausea, vomiting, diarrhea, bone marrow depression, rashes, alopecia, which is loss of hair, and scaling or dryness of skin. And it is contraindicated in pregnant patients or those with kidney or liver disorders. Okay, alkylating drugs are one of the largest groups of anti-cancer agents, and they're toxic to rapidly growing tissues. They do include nitrogen mustard, which was the first anti-neoplastic drug. It was introduced in the 1940s. It was being used in chemical warfare. They kill by directly damaging the DNA strands and keeping cancer cells from reproducing. They affect multiple phases of the cell cycle, and they're effective against multiple different cancers, including acute and chronic leukemias, lymphomas, multiple myeloma, and solid tumors of the breast, ovaries, uterus, lungs, bladder, and stomach. An example of this would be cyclophosphamide or Cytoxin. Newer meds in the group are called nitrosurias. They're unique in their ability to cross the blood-brain barrier. So they're used to treat brain tumors and cancers of the testes and ovaries. And some examples of those are temozolomide, which is Temodar, and carmustine, which is BICNU. Okay, then we have the antimetabolites. These disrupt the cell's metabolic processes by interfering with DNA and RNA growth. Neoplastic cell is unable to divide, resulting in cell death. It's used for the treatment of acute and chronic leukemia, tumors of the ovaries, lung, bladder, breast, head and neck, and the intestinal tract. And some examples include methotrexate, which is brand names are Folex or Mexate, and 5-fluorouracil, or 5-FU or Adricel. Just a quick note too, these may be used for the treatment of other conditions. For example, methotrexate is used to treat ectopic pregnancies and rheumatoid arthritis. Okay, then we have the plant alkalides. These are derivatives of plant extracts. They are also called mitotic inhibitors. Okay, mitotic inhibitors, that's what we're talking about. They block cell division by preventing chromosomes from dividing. They can be used as single meds or in combined drug therapy. And the uses include treatment of advanced breast, ovarian, colon, pancreatic, and lung cancers. And they also are using them in squamous cancers of the head and neck. Some examples include Taxol, Taxotere. These come from the bark and needles of European yew trees. Some other ones are Velban and Oncoven, which are derived from the periwinkle plant, and Topazar, which is from the May apple. I'm going to get entirely too tongue-tied trying to give those generic names. All right, next we have anti-tumor antibiotics. These target specific types of cancers by inhibiting protein and RNA synthesis and binding DNA. So dactinomycin was the first drug of this type to be used in the 1940s as well for treatment of animal tumors. It's used to treat leukemia, squamous cell cancers, Wilms tumor, testicular cancer, ovarian, breast, lung, and bladder cancers. Some examples include bleomycin sulfate, which is blenosane, and doxorubicin. Mitomycin is used to prevent the recurrence of eye regrowth called a tergium, and it treats and shrinks cancerous growth of the eye as well. All right, hormones and hormone antagonists are used in combination therapy for treating various cancers. This includes our androgens, anti-androgens, estrogens, anti-estrogens, and our progestins. So basically, specifically, we're looking at the sex hormones for this. Okay. They also act as anti-inflammatory agents to suppress the tissue's inflammatory processes and to prevent reactions. So when they're used in this way, they're considered steroids, and examples of that are prednisone, methylprednisone, and dexamethasone. Okay, when they're used to kill cancer cells, they fall into the chemo category. Usually the breast, endometrium, and prostate are what we're looking at to treat with these, and those are Luprin and Nolvadex. Right, we're going to talk a little bit about targeted therapy. This involves the use of drugs or other substances that interfere with the specific molecules involved in a tumor's growth. It's sometimes referred to also as molecularly targeted drugs. These are more effective than other types of treatments because they focus on molecular and cellular changes specific to certain cancers. Okay, they're considered the cornerstone for precision medicine. And what that means is it's using the patient's genetic makeup and proteins to diagnose and treat a disease. Okay, there's many approved by the FDA to treat specific cancers such as estrogen receptor positive breast cancer and certain types of leukemia and lung cancers. And some of those examples are Ferriston and Gleevec and Iressa. All right, some biologic response modifiers. These are agents that boost the body's immune system. And the example that they're using for this is the interferon. Okay, natural protein called cytokine is produced in small amounts primarily by our T cells and our immune systems. And when it's given in increased concentrations, it boosts the immune cells so that they're better able to attack these cancer cells. And I want you guys to be sure to read Insight 12.1 on page 168. It is a really interesting look into this type of modifier. Okay, moving on to some gene therapy. This is an experimental technique that uses genes to prevent or treat disease. In the past, gene therapy has resulted in patient deaths, so it was discontinued for quite some time. However, advances in science and medicine have kind of brought it to the forefront again. One case in point is MD Anderson Cancer Center. They found a gene involved in some common cancers that they're calling the mutated multiple advanced cancers, or MMACI. They also performed the first successful correction of a defected tumor suppressor gene, which they named P53, found in lung cancer. In the future, this might allow doctors to treat a disorder or a disease by inserting a gene into a patient's cell. Rather than using chemicals and radiation, we could actually inject genes. But ample research, unfortunately, is still needed for this. So moving on into our search for a cure, there are a couple of terms that I want you to know. Epidemiology is the science that studies factors that determine and influence the frequency, distribution, and cause of a disease and finding a cure. So the epidemiology of cancer reflects patterns based on age, gender, geographic location, and socioeconomic status. So for example, in the U.S., lung cancers are equally likely to occur in men as they are in women. But in women, the leading sites of fatal cancer are lung, breast, colon, and rectum. In men, it's lung, prostate, colon, and rectum. Okay, but like we said, in the lung cancers, they're equally likely to occur either way. And then we have etiology. Etiology is the cause of a disease. So the etiology of cancer is unknown. We do know that there are external carcinogens, which are cancer-causing agents. For instance, tobacco is the most important known carcinogen in the U.S. It is estimated that 30% of all cancer deaths could be avoided with the elimination of tobacco, which is a pretty amazing number. Research is ongoing regarding anti-neoplastic agents. New combinations and higher doses have shown some promise for positive results in cancer treatment. One of the newest classes is angiogenesis inhibitors. These work to block the construction of new capillaries to cancerous tumor cells. Without that blood flow from those capillaries, it prevents the cells from getting the nutrients, and the tumors stop growing or in some cases regress. An example of this is Avastin. That's the first drug proven to delay cell growth. Okay, nanomedicine is nanotechnology that's being applied to medical diagnostics, medication delivery, and treatment of neoplasms. And some studies are even looking at enzymes that are common in all of the cancers and the development of drugs that can be customized to patients. So there is a lot of research going on, but unfortunately we do have a very long ways to go yet before we can find cures. And that is the end of Chapter 12. It is a relatively short one. We will move on to Chapter 13. However, that's in a new unit under anesthesia. So that will be in a separate PowerPoint, but I will see you guys in a little bit. Any questions, please leave them there.